Hello, I'm Dr. David Roberts from Manchester West Veterinary Hospital, and today we're going to show you how we actually use the laser. We're going to use my dog Cruiser as a patient, or as a test subject, if you will. Cruiser has hip dysplasia. We talked about that in our last video, and it shows that this would be a normal hip, nice smooth joint, and this is what Cruiser's hip looks like. It's got bone spurs and all kinds of arthritic changes. So we're using the laser for Cruiser from an arthritic standpoint, for arthritis. And we talked about other utilizations, but today we're going to show you how we do this with Cruiser. What we do is we encourage our owners, the pet owners, to actually stay with their dogs, and we're going to show how we do that. You'll see that it's non-painful. It's actually very pleasing. We've used it on ourselves. It creates a little bit of warmth on the skin, but it actually is like a heating pad that kind of penetrates a little bit deeper because it's all based on a light source. So we'll introduce Cruiser's real owner. This is Sharon, and Sharon will be holding on to him today, and Laura will be doing our laser. So what we do with our clients is we have them put on some goggles. The goggles are basically because it is a very intensified light source. We just want to make sure that nobody has a problem with their eyes. Laura will put on goggles also. I will too, because I'm kind of an old Devo fan, so it's what we like to do. But Laura will go ahead and get started with the laser. What we do is we program in Cruiser's weight, and that is in a computer program. That actually tells us exactly what time period, how much wattage, and how deep this will penetrate with Cruiser because of his size. Obviously, a Yorkshire Terrier and a big Bouvier like him are going to get different penetrations. So we'll hand this over to Laura. Laura's one of our technicians, and she's going to show us how this is done with Cruiser. Again, the wonderful part about the laser is that it is non-painful. It is something that's very comfortable. It is something that owners can be with their pets while we're having it done. But also, it has had great results. We have only about a dozen cases so far, but every one of them have been very, very successful. So Laura will kind of show us how it's done. You can see how she's shining that red light on her hand. It has no pain. It generates a minimal amount of heat, not unlike a heating pad. But because it's a light source, it goes deeper inside. So you see, Cruiser just lays there. Sharon just pets him, and he gets basically wanded, if you will, all around his hip, around the musculature, in the hip joint itself, and all the muscles around it. Again, other applications are for different joints. So it could be done on Cruiser on his lower back here. It could be done on his knee, his stifle joint, or his ankle there. If Sharon would point to his shoulder, and his shoulder up there, and then his elbow down below. Those are great applications, not to mention neck and lower spine for some of our smaller breed dogs that have more of the neck and lower back problems. But as you can see, he does fine with it. He just lays there. He probably would rather be having a treat somewhere else right now. But that's how it's all performed. That's how we do it with our patients. It's very easy. It's quick. It takes about 6 minutes for the entire process on both of his hips. And when they're done, these pets go home, and owners have told us that they are literally like puppies again. I may not have believed it if I hadn't seen it, especially with my own dog, with Cruiser, but we're seeing that. So again, we're starting to talk about laser, therapeutic laser, and how it's the wave of the future. I'm Dr. David Roberts from Manchester West. Thanks for tuning in.